is Roger Green, host of the Surfing the MASH Tsunami podcast. This week, we are offering 4 conversations from episode 2, our discussion with leading patient advocates, plus, from the vault, a conversation from March 2023 with Jeff McIntyre about the value of MASH medications. This final conversation has 2 pieces. First, I ask each advocate to discuss their respective organization's most important project of the year. Wayne Eskridge discusses the annualization of Fatty Liver Foundation's State of NAFLD Care in America study. Tony Villiotti talks about creative approaches to educating children, including having his 10-year-old grandson visit schools as part of NASH knowledge education dream, dressed as a character called Livvy the Liver. Milan Mishkovikj discusses the expansion of a project to conduct liver screens of legislators and executives at the European Parliament in Brussels, and to use these screening tests and results as a way to open conversations. Jeff McIntyre discusses GLI's Advanced Advocacy Academy, or A3, which trains activists to advocate for themselves in their own countries and states, and describes the program's success in growing roots, as he puts it, turning into a year-round program with ambassadors and multiple outreach efforts in different countries, regions, and states. Louise Campbell discusses the need to put patient education at the center and some creative techniques used in Australia. When everyone's done, I ask group members what they would consider a successful 2024 if we repeat this session a year from now and look back 12 months. You'll have to listen for their answers. This conversation yields 3 common themes: the guarded optimism of the patient advocates as they await the Resmetirom PDUFA date, their desire to be included in discussions about patient access and value, and finally, the different kinds of exciting work and programs each sees on the agenda for 2024. I always find our episodes and advocates to be equal parts energizing and thought-provoking, so just sit back, listen, learn, enjoy. When you're done, join the dialogue in our LinkedIn discussion group. I'd like each of you to talk about one program in particular that you're excited about in 2024, that your organization is putting forward. Just pick one.
Wayne Eskridge.
I'll be happy to start. Our flagship product is what we call the State of NAFLD NASH Care in America, which is a survey of patients and their experience before and after that they've been diagnosed. And we've been doing this for a few years now. One of the things that we're excited about, if you will, is that with the nomenclature change, we are interested to see what kind of changes take place over time in the patient community and how that affects the way patients are diagnosed and or the kinds of support that they receive. So this will be a very interesting year for us since the nomenclature is a brand new wrinkle in our field.
It's a great piece of work, and I can't wait to see what you come up with this year. So thank you for that. Tony, go ahead.
Tony Villiotti.
Yeah, Roger, an episode or 2 ago, you and Louise talked about the concept of liver awareness, and that's really the world where we live. So our top goal for this year is to get into schools to talk to children about their liver. And in that regard, we've developed a relationship with a local organization that has an exercise program for children, and they have relationships with 250 schools and community centers. And we are now their nutrition partner. And in 2 weeks, we're having our first visit where Gina and our executive director will be addressing about 160 elementary school children in a local school district. Now, the onus is on us to make it like an entertaining or engaging exercise. So we've arrived. My 10-year-old grandson is going to dress up in our Livvy the Liver costume and going to accompany Gina into the school. And she'll be talking about, hopefully in an engaging fashion about the importance of the liver, what about liver disease, what the liver is, what it does, how to keep it healthy. And we're envisioning doing a lot of that this year. And that's our number one initiative.
You guys do such cool stuff. That's great. That's great. Milan, one initiative this year.
Milan Mishkovikj.
This year also we will continue with one of the pilot programs which we started 2023, which was very successful. That was the European Liver Screen Week in front of the European Parliament. We have enormous success, I must be honest, because for the first time we have such a great opportunity to introduce the liver screening to all the MVPs in the European Parliament and together with the high-level event inside to discuss about all the challenges. This year we particularly like to make a bigger, initiative to make maybe 2 or 3 different mobile units, which we used the last time. We like to do this on the practical way to see the people that sometimes are very easy, some kind of diagnostic tools. You can see just some of your results for your liver, which giving, a perspective that do you have some kind of problem or not. We like to show to the policy decision makers that we need to establish some kind of liver screen programs in Europe, because through the initiatives which is going on the moment in European Cancer Plan was are established 8 different screening programs. We will push also liver screen initiative together with ESL, with all our partners, and we are also grateful for the support of July because they were part of this initiative. We're trying to show not just with education and high-level meetings, but practically how they can see on the spot what we can do very easy to discover the status of the stiffness C and the cup. And this is also an excellent opportunity for the all national members who will support this year, this initiative, because we like to make this initiative to grow in more countries in Europe.
Fantastic. All three fantastic. Jeff, you have anything you want to add before we go to final question, or Louise, about a program?
Yeah, I'll add one quick thing, and it's the thing I'm most excited about that we've really grown this year at the Global Liver Institute is our Advanced Advocacy Academy, also known as A3, in shorthand. And while this is kind of the heartbeat of what GLI does, and it's our patient engagement and patient training kind of program here within GLI that recruits globally for patients to come to Washington, usually in September. But what I'm most excited about that is that we had such a great response last year to our 80 plus patients and caregivers that showed up for our training and our Heal Day, is that it actually grew roots. And so now this is a year-long program. We have created an ambassador program around it in areas such as clinical research and digital health that are now being patient-led and patient-driven. And we're just super excited about this, that we can support patients in their areas of need, that they can then get education and training on how to do everything from talk to their doctor to be able to tell their story to the officials, to be able to help one another with working their way through different medical portals or clinical trial portals or answering those questions as well. And personally, I've just met some tremendous people that have waged battles that I can't imagine in this area. And so I'm really thankful, and we're looking forward to continuing our program. I presented on clinical trials to a great group last week, and I'm just super excited to keep that going.
Fantastic. Louise, anything you want to comment?
Louise Campbell.
No, I was just in awe at the 4 topics that were chosen there and the breadth of those. And that's why patients are the best place to be involved in the entire process, at the center, at the core, and it should be all designed around that core as the patient, because they do know best. And if you just listen to those topics for how it affects the patient in the name change, how it's done all sorts of things there, spread out, it's just amazing. And I'm looking forward to seeing those. And I obviously align with looking for liver health and Tony's engagement with children. And there's some interesting things you can do, from wearing boxing gloves to show how difficult it is when you're a liver cell to try and move things. If you put boxing gloves on the kids and get them to lift little things with their hands and things. There's all sorts of exciting things you can do to getting children engaged. So I'm really excited to hear the results of those.
So Louise, you and Gina should write a children's book.
Well, there's a great one here in Australia called Gary the Goanna. The one thing is, everybody keeps writing the liver out of the story. Now, with the approval of resmetirom, we may now have to write back the liver into the story. You go on a diet to change your heart. No, you go on a diet to change your gut and your liver to help your heart. You're on a diabetic diet. No, you're on a diet to change the gut and the liver to change your diabetes. So we need to write liver health back into the story, because it is the biggest player before we get disease. Now, that does not include, obviously, the rare diseases, but by looking at liver health, we will pick up disease. So it is very much what these guys are driving globally and in their regions. And that's what fills me with excitement, is watching what's coming with this lot and the other advocacy organizations around the world.
Excellent. Okay, last question. It's 12 months from today. It's February 13th, 2025. What will tell you whether you've been successful looking back over the last 12 months, whether you and your organization have personally achieved what you set out to do in a good way? Brave one, go first.
In our situation, because we're dealing, most of what we deal with are people who aren't aware, who don't know anything about liver disease, fatty liver disease. So we'll track the number of people that we reach and, hopefully impart a lesson, to them about liver health and so forth. So it'll kind of be number of people reached will be how we'll judge our performance.
Okay, Wayne.
Wayne Eskridge.
principal focus for us this year is to do a better job of engaging our ethnic and underserved communities. We've had a lot of experience, like everybody in this field, with the Caucasian population, that we really want to build our access and our support for the ethnic and underserved communities. So if we can get those numbers to reasonable values in our various programs, I'll be happy.
Okay, Milan?
If you see previous success, what we've done a little bit, I will say, and how we go out from the frame, 2023, I will mention, and it's coming 2024 with the year of elections, with new policy decision makers who's coming on the scene. We will continue the work which we like the new group of politicians who's coming on the scene to understand the needs of the liver groups. And this is most important because especially the past 2-3 years, somehow we managed liver disease to put higher on the political agenda in Brussels. And now we like to continue to stay there and to improve our status, of course, and the new establishment which are coming from the beginning to understand the unlimited needs of our communities. This is number one, which we will focus. And the second part is the focus is the same time health generally to be on the agenda because we know that after COVID, European Commission changed the pathways and for the first time in the history make such a good, excellent improvement in the health. And our fight is, let's say, to stay the health high on the agenda, and after that, liver disease to get the deserved place among the other diseases. Because we know that in the past was a little bit difficult, even barely to mention was the question about liver disease somehow on the political scene at Bristol. But the last mandate of this parliament and this commission, we are so proud that we have achieved so many things. We are not satisfied. We need to work much more, much stronger, and we need to have much partners and stakeholders like you who will share with us all the moments. This is very important for us, and I hope so that in one of the next meetings I will have the privilege to invite all of you. July has already every year with us, but I hope so all of you to come to visit Brussels and to see all the possibilities what we can do there. It's a pleasure, Roger, that you invite me tonight and have the chance to say a couple of words about our mission and our work and our partnership with all of you.
So I have one Belgian grandparent. Obviously, I'm old, so my grandparents been gone for a long time, but I never pass up an invitation to go to Belgium. So I have to figure out how to get to Milan, but thank you very much for that. Jeff, 12 months, how have you gotten this right?
I think I will stay consistent with the theme of today's discussion, Roger, and that's the hope and the optimism that we have an asset approved, have a drug approved, and that we're able to work through the coding questions, through the payer questions, through the reimbursement questions, all these things that have been, knocking at the door for us that we've been talking around for the past, however many years. And that this sets the stage then for us as patients to be able to start pushing these conversations in other countries globally. And so we're queued up, not just in Europe, but in Latin America and in Asia on this, that we're already looking 2 and 3 steps down the line on this as well. And then we're also able to keep it at home here in the U.S. and looking at what are the next assets that are in the pipeline that may not deal with the exact same population, but then how can we continue this good momentum of positive results in patient access for that?
Excellent. Louise, you got one?
I was just thinking it's Valentine's Day here, so I am just going to say that I'm going to love watching the liver become the hero for next Valentine's Day, because I think we are going to start to write it back into the story. And if you love your liver, you can love your life. And that's what we're doing. So happy Valentine's Day from Australia. And you guys will join me shortly.
And anyone who knows a good children's book illustrator, please send that information to Louise so she can get the children's Love Your Liver series into the works. Milan says he's got one. Okay, fine. You guys could talk about this later. I'll tell you what I would like to see in a year. I'd like to see alignment enhanced, because first drug approvals are the moments when alignment either gets a lot better or a lot worse. And to me, alignment is payers know what they're paying for, physicians know who they're prescribing to, patients know why they're supposed to take it, and the advocates kind of become really the fulcrum for putting as much energy into getting all those elements right as possible. This is a huge disease. We get one chance to get it right the first time. And they say you never get a second chance to make a first impression. I don't think that's quite right. You can make a second first impression, but it's really painful and expensive. So if the first impression is well aligned, then I think we do great.
And now, back to Roger.
We hope you've enjoyed this recording. If you have any questions or comments about the content of this conversation or the entire episode, please put them in the review section of the page from which you downloaded this conversation, or send an email to questions@surfingmash.com. We'll be back next week with some of the leaders of the nomenclature process to discuss its successes, lessons, and next steps. Until then, stay safe, surf on. We'll see you on podcast. Bye-bye now.